Well, I think that in order to get testing up to the level that we need, certainly local and state areas are going to have additional funding. I think that we're beginning to see some increased second phase activity in some states, and right now I think we have suboptimal infrastructure for testing. It's not just testing, as you know, it's getting the test results back in 24 to 36 hours so we can do contact tracing, so we can find individuals who have been exposed, so we can test them, and so that if they are infected as well, they can go into quarantine. So that's the critical element. And without, this is how many times have we had to say this? Without an adequate testing infrastructure, we're in trouble, and we're just going to be subject to these continued waves of COVID-19 outbreak. Not like a sinusoidal wave, but this could be a more tsunami-like wave at some point.
And on top of the lack of testing, obviously people still awaiting a vaccine. What do you think will determine which vaccines get to market and approved first?
Well, I've been involved in two major pathogens where we've developed vaccines. And those vaccines have more or less failed. Those are vaccines against HSV2 and vaccines against HIV. Both of those vaccines look good in second stage and failed when they were rolled out on a larger level, in research, that is, in phase 3. So I'm still concerned. I mean, I wish I shared Dr. Fauci's optimism. Clearly, it's better to have 9 or 10 vaccines coming down the pike than having one, which was the case more or less with HIV and herpes as well. But when you go from a few thousand to 20,000 people, you begin to see the variation that we as people express in terms of our immune systems. And a vaccine basically affects our immune systems, and sometimes those effects are untoward. Sometimes they're unexpected and cause problems. And so I'm still anxious to see the third phase data. And I wouldn't bet on anything. I'm an optimist, but I still think we have a ways to go before we can say we have a vaccine.
Now, we do have a number of companies around the world entering stage 3 trials. We know that Johnson & Johnson has now entered that phase. We've got China's Sinopharm being distributed in countries like UAE and Pakistan, and also Sinovac in Brazil. How important are these milestones, as well as these sort of international collaborations when it comes to developing a vaccine?
Well, I'm very encouraged about international collaboration, but my reason is less around manufacturing and pushing the vaccine forward, as in the fact of the two facts. One is that the vaccine gets to have some equitable distribution around the world, because we do live in one world, and this type of pandemic by its very nature affects a broad number of countries. But the second reason is there is immunologic variation among populations. We know this with the HPV vaccine. And we know that there's a lot of different HPV infection differences around the world. So having a vaccine rolled out in multiple locations, hopefully in phase 3 research, not just vaccinating people, but in control research, we'll be able to see some of the geographical variation, and this will be important as well. It's not clear that a vaccine that will work in the United States may have some different issues in the Middle East, China, and elsewhere.
And to that point, I do just quickly want to get to this, because we are running out of time, about the FDA's guidance on any vaccine approval and what sort of protection some of these COVID vaccine developers are asking for when it comes to, the ability to not get sued with these different countries and their different legal systems.
Well, that's a very good point. Many years ago in the United States, we we sort of had a very quiet thing happen, and that quiet thing was the people making vaccines were no longer liable. That basically they were self-insured through the federal government, through the Federal Court of Claims, and that if something goes wrong, then you go to the Federal Court of Claims and make your case. You don't go to the company. Now there's attempts to broaden that liability worldwide. I don't know how international legal systems are going to mesh about this. And I do think you have to encourage vaccine manufacture,
right.
and that liability clearly is an important issue, but you know, it's not all of the world is in the U.S. sphere of liability focus, and that could be hard to negotiate and translate overseas.
We'll certainly have to see. Thank you so much. We do appreciate your